first helicopter, and I went out to the...
Oh, that landed on the helicopter side.
Yeah, I went out to the airport and I rode in with them in the helicopter.
Oh, nice. Oh.
I'm Sister Margaret Ann Hardner. I was born and raised in Erie, Pennsylvania, taught by the Sisters of St. Joseph, entered the convent when I was 18 years old. When I talked to the Mother Superior about entering the convent, I was bold enough to say, I never want to be a nurse. I don't want to have anything to do with hospitals. She said to me at that time, don't worry, you don't have to worry about that because we have other jobs. And so in 1974, I'm in charge of the hospital. When I first was appointed, I remember standing outside. It was dusk, getting dark, and I looked at the hospital and I thought, what do I do now? The next day I went in and everything worked. I had no knowledge of nursing or physician or laboratory or this or that, but we had people who could do that. We worked as a team, and St. Vincent became the best hospital in the state. It just so happened that I was reaching my 65th birthday. The trustees were talking about succession planning, and Sister Catherine was willing to do it. And thank God for Sister Catherine. So it got me out of the hot seat. And she certainly did a great job after that.
Sister Margaret Ann said, why don't you come up to the hospital, just learn the ropes here. So I did that. There was a lot I didn't know. I never studied health administration. I learned by the seat of my pants, as they say. Trust is really critical when you're dealing with somebody. That's the role of a leader. I don't have to know what every doctor knows. I have to know that that doctor is in the right place. So it's not about knowledge, it's about understanding people. One of our main aims as a Sister of St. Joseph, we've always responded to the needs of the time and the people. That's what St. Vincent is doing. And I wish them another 150 years of excellence.
I don't think I could be more proud of any institution as I am of St. Vincent.
I worked at St. Vincent's for 45 years because it's like family. A lot changed in 45 years, but what hasn't changed is the overall culture, the continued support of the Sisters' mission. It's the patient first. You know from the get-go that they are there to provide excellent, quality, compassionate care. You'll see a lot of legacy at St. Vincent. There are a lot of families that work there. I know our family isn't the only family that has been there a long time. You will find a lot of staff there that have no desire to go anywhere else because we work as a team. I feel so blessed to be part of St. Vincent's legacy. The Sisters of St. Joseph that started our hospital 150 years ago have done so much. What they did to get this hospital started is absolutely amazing.
This was 150 years ago. I think my favorite's the OR one, because that is not what it's like now. My mom had a stroke when I was 12. That experience kind of shaped me to be, the person I am today. I'm forever thankful to those people because not only did they, help my mom heal, but they also allowed me to, fall in love with medicine, fall in love with, the hospital. I'm currently a patient care tech in the ICU department at St. Vincent. It's my first hands-on experience working very closely with patients, and especially patients in clinical care. The nurses would always ask me, hey, are you okay? Is there anything we can do for you? I think that really went a long way, and it allowed me to get that comfortability in that environment. When you have a staff that looks out for you, it makes your job a lot easier, and it makes coming into work a lot easier. St. Vincent set me up for my future because my goal is to one day become a physician's assistant. And I think the experiences that I've had here have definitely shaped my ability to do so. The people that have come before me, I feel like they're passing the torch on to me, and it's my turn to be that helping hand in the community and to advocate for my patients and to be the best healthcare provider I can be.
I am a retired nurse. I am a mother, a grandmother, a great-grandmother, and I beat cancer. I didn't think anything like this would happen to me. I worked hospice for many years, so I worked with a lot of cancer patients. So you hear the word cancer and you're not sure how to feel. But through the whole thing, all the staff made me feel at ease. My first visit with Dr. Saldana, she went through everything with me. She told me my options. There wasn't a question that was not answered. So the day of surgery, the surgeons, they mark the side that they're going to be doing surgery on. So she asked me, she says, would you like a heart or a star? And my family being there, they said, oh, if you know my mom, she's very patriotic. Well, she drew a little flag on my chest. So my daughter took a picture of it. And she says, oh, put it on Facebook. So they did, and everybody got a big kick out of it. I can't say enough about St. Vincent's and their staff. And I just hope to God I was as good of a nurse as what all these nurses and doctors have been to me.
These are my sonograms from 2 days before they were born, and we knew that there would be a potential issue. Every time I walk through the halls of St. Vincent, a birthday, a milestone, you never forget that gratitude. For anyone that's received life-saving care, you don't forget the eyes of the nurse that helped you through something. That gratitude will always remain. When we found out we were pregnant, I think at 14 weeks we realized it was twins. Immediately we knew that there wasn't a lot of hope, that there would be complications, and then the words, we are lucky to get you to viability. Any parent wants to have that dream of seeing their child for the first time, and so keeping that hope was scary for us. Our girls were born just after 25 weeks, and so they were 15 weeks early. We were told to not expect much in delivery, that they'd be too weak to cry, that they wouldn't, make a sound. And when they entered this world, one entered with a little peep and one entered with a squeak. And for us, that meant everything. So Lincoln was born weighing 1 pound 7 ounces, and Quinn was born weighing 1 pound 15 ounces. They were tiny. They were the length of a ruler. Our whole pregnancy, there wasn't much hope. But once we got to NICU, they didn't even pause or hesitate to say, just, wait until these girls go to prom, wait until they're driving, they're gonna give you headaches, and they were right. So working at St. Vincent for me, it's a dream. It's the ability to give back and provide life-saving care for other people. Every time someone gives, I get the value of that as a parent, as a patient, as someone who's in philanthropy and the difference that it can make. Lincoln and Quinn would not be here without the staff in the St. Vincent NICU. They wouldn't have survived. They, with their skill and their abilities, they were able to literally breathe life into our children. And I'm so grateful for the hope that they gave us. They made us believe.